Hey guys, it's Dr. James Ken again. I have a patient here and they have what we call a pincer nail, P-I-N-C-E-R nail. What happens is a normal nail, it grows typically straight across, and what happens when we get a little bit more mature in age, sometimes we can grow bone spurs that grow up and it causes the nail to become what we call a pincer nail. So what happens is the nail curves around this way and you start to develop ingrown toenails here and here, and this patient right here has them actually on both sides. So if you look at this little blackboard, this is a typical normal nail, okay? So we've got this normal nail right here, and what we got going on, this is the bone, this is the skin, and this is the toenail going around that area, okay? What happens when we get a little bit more mature in age, we start to develop what we call an exostosis, or a small bony growth that grows up there. What happens is the nail starts to have a small curvature, and when that happens, the pincer nail causes pain here and causes pain here. So if you take out the sides right here, or take out a side here and a side here, it looks more like a quote-unquote normal nail. Now, how did I do that? You actually have to burn the matrix out, and that is the root. This small pink area right here, that's where the nail starts to grow. So typically a nail, it takes about 9 to 15 months for a toenail to grow from here all the way out. So if you're looking at this, you might see a couple of months of growth right here and you don't even see it from the ingrown toenail. So I actually take a small section of the border off, maybe about 1 millimeter, to see if I can get that thing to not come back. But on some patients, if they don't want to have a permanent ingrown toenail removal, I do what we call a slant back procedure, and that's what I'm going to do today. Typically, slant back procedures are not very painful at all. I don't have to numb them up. They're more of a temporary solution, but sometimes a patient is going on a vacation or their deductible's high or whatever, and they don't want to have that done at the moment. So the next best thing is to do what we call a slant back. So a slant back is actually a procedure where I go in just like this, and what I do, I actually clip out the side here. So I actually grab it inside. These are very sharp nippers, so the sharper they are, the less they'll hurt. But what I go in here, just like this, and I clip it just like that, just like this right here, and then I actually grab it, and then lots of times I like to twist. I'll go in just like this, and then tell me if it's hurting you. But typically, I'll grab that out like that, and it'll decrease a lot of pressure right in there. So this patient right here should get some instant relief. So what I'll do, I'll actually remove this side, that side, and that side, and then she'll be through. Again, will it come back? Yes, it will. However, it can get her temporarily by for going for swimming or whatever she's having. But typically, if I remove an ingrown toenail, you see this mark right here, this purple line. That is how much border I will remove. And if you look at this nail, it's actually stuck into that border. And obviously when I push up this way, it would cause more pain. But now I've taken out a little smaller piece, she's not going to have near the pain that she has. But I typically take out about 1 millimeter or 2 millimeters, and I burn it out with acid, and I also burn it out with a laser, a CO2 laser. So that's kind of how you do a slant back. And lots of times they will prevent ingrown toenails from coming back as quick, and it'll also prevent a nail from becoming infected, and that decreases a lot of pain, and that's the reason why I don't want to have to prescribe an antibiotic. Thanks, guys.